Hello and welcome to Health Matters on Channels Television. It's great to have you join us today. I am Mary Alale Yusuf. In the procedure known as gastrointestinal endoscopy or GI endoscopy, a doctor is able to see the inside lining of your digestive tract. The GI endoscopy procedure may be performed in either an outpatient or inpatient setting. Through the endoscope, a doctor can evaluate several problems in the gut. My guest is a general surgeon at the Melfort Hospital, Melfort, Saskatchewan in Canada. He's also a clinical associate professor of surgery, University of Saskatchewan, Canada. He's licensed to practice in Nigeria, South Africa, and Canada by the Medical and Dental Council of Nigeria, Health Professions Council of South Africa, and the Medical Council of Canada. Dr. Yemi Laoshebikon, you're welcome to the show. Let's start with you describing what an endoscope is.
Yes, an endoscope is an instrument that is used to visualize the intestines, and it's basically a camera that is loaded onto a flexible type of a telescope, in a simple way of putting it, that is introduced through a natural orifice to visualize the intestine. And nowadays, the image is projected onto a TV screen for better visualization.
Okay, so just quickly describe for us, since we had the 1806 model with the tube, the mirror and the candle, you know, the stages that this has gone through. Well,
when I was training, we had rigid endoscopes, and that could only go so far within the gut that is very floppy and has its own natural curves. Then the introduction of the flexible endoscope, which you had to look through, but nowadays it has been connected to a video system where anybody in the room can visualize that, and as a matter of fact, you can transmit that image outside of the room.
Okay, so what kinds of diseases do you evaluate using a gastrointestinal endoscope?
So a gastrointestinal endoscope will look at any disease involving the intestine, be it in the esophagus, the food pipe, the stomach, or the small intestine. And you also have scopes that are designed to look at the lower intestine. So things like stomach ulcers, acid reflux, stomach cancers, polyps, and even cancers and polyps in the colon.
Okay, so colon cancer can be discovered using the endoscope. Stomach cancer?
Yes.
Cervical cancer?
Cervical cancer, a different type of scope, can be used for that.
Okay, so why is this so important? Let me explain. Before, even now, people take samples, you know, sputum, whatever acid comes up, you know, stools, urine. Why does this procedure seem so important?
It's one of the tools that you have to facilitate detection, as well as treat, in some cases, diseases of the intestinal tract. So that is one of the benefits to the individual patient. It also allows, it saves you the pain of invasion from an incision. So we go through a natural.
So it's less invasive.
Less invasive and more comfortable on the long run for the individual. For the physician, it improves and the efficiency of the physician in making a diagnosis and in facilitating treatment. And for society at large, if I as a physician can get to what is wrong with the individual early enough, and I can treat it early enough, I can get that individual back into the society to contribute to socioeconomic development. So there's a lot of benefit for the general population and the country at large if this is readily available and it's used appropriately.
Let's say, for example, you introduce an endoscope and then you view that there's a polyp or two, you know, in the colon. Can you clip it immediately with the same instrument, or do you introduce another?
So with the same instrument, I have the ability to introduce accessories to now perform a procedure. So that is one of the benefits of endoscopy when you find polyps. Now, I must say that not all polyps can be removed, so you have to visualize the characteristic of the polyps and decide whether it's amenable to endoscopic removal or not. If it is, then you just put in your accessories to facilitate that. So it can be a one-stop shop for that purpose. Is
this method, is it somehow like the only hope for certain diseases, or it's just another method?
It is just another method, but a very important method. The other alternative, if you do not have the opportunity to perform endoscopy, is to go and open that patient up and see for yourself. So it is a better alternative than what we used to have available.
Okay, so how is this better, for example, than a sonogram, which doesn't invade, and maybe an X-ray?
All right. So one of the ways I try and explain this to my patients is that if you took a picture, back in the day, we had black and white. But now that we have pictures in color, you see better definition of who or what you are looking at. The other way of looking at comparing X-rays to endoscopy is X-ray is the negative image that the print